Hi, welcome back to the Healing Medicine Show as part of LinkedIn Live. This is a show that provides a platform for health and healing professionals to grow in their understanding and practice of what it means to be a healer. So, we aim to provide healthcare professionals with resources as well as inspiration for both professional and personal development practices, especially those rooted in holistic health. We really believe that the change in healthcare starts by focusing on the health and the healing of the healthcare provider. So if you have a colleague who might enjoy this show, please send them the link to share this newsletter and share this interview with them. I have joining me today Douglas Tsoi, a spiritual director and financial coach who has achieved FIRE, that's financial independence, retiring early. And he talks more about how he works with his clients to not only develop spiritually, but develop a financial plan that helps to serve them in their highest good. So, Douglas, thank you so much for joining us here today.
Oh, thanks so much for having me, Blair.
So, I invited you after listening to a fantastic interview you did with Doc G. So, Doc G is a mutual friend who has a podcast really about financial independence for physicians and healthcare professionals. And my hope during this conversation is not only to get to know each other better, but also to have an inspiring conversation around spiritual, personal, professional healing and development. So I really agree with some of the stuff you mentioned on Doc G's podcast about putting the care back into healthcare. And, it's pretty clear now with healthcare professionals looking to seek FIRE to escape the rat race of corporatization of healthcare. So my hope is really that through our conversation today, we give them something larger to shoot at and powerful tools that they can use to help them get there quickly. So I want to start off this interview by asking you, what does healing actually mean to you?
Yeah, it's such an amazing question, Blair. I think healing for me means moving towards health. And health for me means it's not the absence of disease. It is a elevated state of well-being. And so healing is about moving towards an elevated state of well-being. And, it's not only just physically, like you can actually be in pain and have that elevated state of well-being. But it's the sense of, mental, emotional, community, physical, all these ways that we can have a sense of well-being, all integrating into our lives.
100%. Yeah, I really like that idea of well-being. It's something that I think more and more healthcare professionals are, as we're seeing with the Great Resignation. People are looking to leave healthcare because of what they're dealing with as employees. They don't have the autonomy to be able to practice their healing arts in a way that is in alignment with how they are personally approaching their own health and well-being. So, talking about the things that I use personally, Reiki healing, sound bowl, frequency healing, acupuncture, meditation, yoga, Ayurvedic medicine, has really started kind of a conversation between healthcare professionals around, what was once considered alternative or complementary medicine being really integrated into the allopathic medical model. And I think it starts with the individual, right? So this sense of well-being, part of that can be tied to your work. So I want to hear a little bit about how, working with people to achieve FIRE and being a spiritual director, what is your journey? What does your path look like?
So the quick story is when I was 22, I graduated from college, and the first job I got was at the Justice Department in Washington, D.C., and I made $25,000 a year. And I just felt rich because in college I was pretty poor. Um, and so I lived on $5,000 a year. And so my first year out of college, I made $25,000 a year and I spent 15. But $15,000 was literally 3 times more than I was spending the year before. Um, and so I just made a decision, and I can't really like go back and tell you why, but I made a decision right then and there that, financially, spiritually, environmentally, which is a big thing for me, if this was enough, and the sense of enoughness is what I really focus on in my spiritual direction practice. If this is enough, I was just drawing the line right here. And no matter how much money I would make in the future, I was just going to spend that much. So for the next 20 years, until I was age 42, I lived on about $25,000 a year and saved and invested the rest. And so I got laid off when I was 42, and I just looked up and I realized I took a workshop with Mr. Money Mustache, sort of the big leader in
Oh,
the
yeah.
financial independence movement, and JD Roth, Mr. Money Boss. And when I took the workshop with them, I was doing the math and I realized I had already done the thing they had told us to do. And so I just realized I was financially free. And I think the big jump for me was, I'm a child of immigrants. I was saving half my income. Like I was banking, like basically I was going to work 35 years. And for every year I worked, I was going to have a year of income. And I just didn't account for the miracle of compound interest. I mean, I knew it was existing, but I just didn't account for it. But, when I actually heard from Mr. Money Mustache, I just realized, oh, I actually have enough not to have to work again. And then I was free to do the thing I was supposed to do in life.
Was
And that, I
that,
mean, quite frankly, is health, right?
yeah, I was about to say, was that freeing or was that terrifying? Like, I can imagine, like, when you have these money stories in your mind of a scarcity type mindset that, it's hard to figure out where is that line of enough.
Yeah, I mean, I think everyone who hits financial independence goes through this moment of terror. Like, oh, I don't have to work anymore. What does my life mean now? But it's both like it is both a challenge and it's the greatest opportunity for life. And I hope we get to talk about one's dharma in this interview. But like going and being able to fulfill your dharma and like that sense of aliveness you feel when you're doing what you're supposed to be doing is the opportunity you have when you don't have to, you're not compelled to work for money anymore.
I love that. So yeah, let's go into it. What does that word dharma mean to you?
Uh, you know, I am not a Hindu scholar, but for me, dharma means, it means truth. It also means path. But it's the sense of you have a thing that you're supposed to do in life, and it actually makes you feel most alive. And if you look at any person that is a hero of yours or pursued a path of greatness, they fulfilled their dharma, right? Like whether it's Abraham Lincoln or Beethoven or Mother Teresa, they all had a thing that made them most alive, and they did it. And that's why we admire them. And that's the opportunity.
I love that. I love that. And that word truth. So I have conversations with a lot of healthcare professionals who in their own personal practice have integrated Eastern type medicine, indigenous medicine, plant medicine with a modern medicine approach, but it's not being reflected in their day-to-day practice. It's not being reflected in their conversations with patients, but yet in their hearts, that is the truth, that they want to focus more on nutrition. They want to focus more on holistic medicine, but yet our current modern healthcare system just isn't really set up. And figuring out how do you walk in your truth? How can you do that today, so that work doesn't feel like work. It feels more like a calling. So I really resonated with that path of discovering what is enough, as well as what are you calling into being for the next chapter in your life. So I can see how it can be really helpful to have someone who has walked that path ahead of you, and it's kind of saying, here's some tips and strategies in order to overcome some of these challenges. Because I'm thinking we all have things that we would change about about our environment. So taking the time to really step back and discover what those things can be is what this show, this discussion, these conversations with people are about, to really get healthcare professionals thinking about what would it look like were you to be walking your path, walking in your dharma.
Yeah, it's super interesting you're saying this, because when you talk about like your listeners who have something in their hearts, right? And you use the word heart, and what they have to do professionally is different than that. Like the first word that comes up to me is this Quaker sense of integrity. Integrity is not only truth, like the Dharma, but it's a sense of wholeness. And when you have to work in a healthcare system that you don't totally agree with, there is a bifurcation between your head and your heart. And there's a spiritual saying that the greatest distance in the world is 8 inches. It's between your head and your heart. And so immediately think about that sense of integrity. And when you hit financial independence, you suddenly get to integrate yourself, and integration of the sense of not only truth but wholeness, right? Like now, and I suspect every single one of your listeners, as their healthcare professional, had a sense of their dharma. They wanted to be a healer, right? And they entered a system where they couldn't do exactly what they felt, and so they feel bifurcated. And so financial independence is opportunity to bring yourself together, bring yourself home.
I love that. Yeah, I can see that the dissonance happening between what we were taught, what's in your head, how do we approach evidence-based medicine, that can be a whole nother conversation about like who is completing that evidence and research, because that's the biggest pushback I hear for Eastern complementary healing modalities is, well, where's the evidence? Where's the evidence that works? And much of that evidence is anecdotal, but we could also say, if you're looking for evidence that's created by the pharmaceutical company, that is not free of bias either. So,
right.
There's still some conditioning that's happening. I really like what you said about those of us who went into healthcare thinking it would be one thing, thinking that we would be able to heal people and to help them achieve better health. And once you're in there in the day-to-day, realizing there are so many constraints on your time and the connections you're able to form with patients. In your opinion, what are some steps providers could take to begin healing the healthcare industry, and to be able to, you use the word integrate, that mind and heart approach to their day-to-day practice?
Yeah, I mean, first of all, I'm not a healthcare professional, and I can't really comment on like sort of the pressures and the constraints that healthcare professionals have compared to what they truly believe. But one of the things that occurs to me as you talk about health-based or evidence-based medicine is, there's some things that evidence of, and some things your body just knows. Like when you're talking about Reiki, right? I literally don't know what the evidence for Reiki or acupuncture is, but the body knows. And some people, like on some level, it doesn't matter what the broad evidence is if your singular data point says this makes me feel better, it doesn't matter what anyone else says, if and I think the separation between ourselves and our consciousness and what's happening in our body is a major problem.
Yeah, can you talk a little bit more about that separation between the head and the heart, how does that happen, and how do you help people to move forward to kind of shorten that 8-inch distance?
Well, I mean, I think, in allopathic medicine, there's a sense of like, we are the experts and we know because of all this evidence that we've had earlier, right? And my understanding is that if I remember correctly, half of all AMA recommendations are overturned or substantially changed within 5 years, right? So, but that's a scientific method. Things change, right? And that's good. And at the same time, like, listen to yourself, right? Like, we give so much authority to the experts, and we surrender the authority of our own personal experience. And we can't listen to it because we're told, even all the way into our schooling, and my career as a school teacher, we're told that someone else knows better, and we have to learn what someone else knows.
I love that. So surrendering authority, that's conditioned from a very early age. I remember, raise your hand, raise your hand before you speak, and stay in line, and don't, like, for me, there was a lot of, don't be a smarty pants, don't answer every single question. It was really some conditioning that carried with me in through pharmacy school. And when I got to practicing, and then I was kind of considered the authority, then there was this moment that was like, okay, well, does how I'm practicing align with my spiritual beliefs? I was interested in herbal medicine. And actually, the reason I applied to pharmacy school, I remember writing on my pharmacy school application that I wanted to study novel drug development in the Amazon rainforest. And so there's always been this sense of, I know that even though there is less evidence that, statistical scientific evidence for some of these ancient healing modalities, there is much more experiential evidence for these practices that are thousands of years old in some cases. And for me, a lot of my journey was getting back to looking at herbal medicine that's available here locally. So I'm in the state of Arkansas, so I've always been interested in plant medicine and healing modalities that you don't really think of as that a pharmacist would be interested in. And I think that there's this also rebranding that needs to take place in healthcare of what it is we actually do. We've kind of gotten off the rails, especially in pharmacy. We're so tied to the pharmaceutical medication that all of our training in biochemistry and in physiology on the cellular level is kind of set to the side. And as I'm talking to more and more healthcare professionals, it's like, well, we actually believe that less medicine is a healthier choice than putting people on more medicine. So if you come to me to ask for a recommendation for, I don't know, constipation, I'm going to give you 5 non-drug recommendations before I point you to a pharmaceutical medication. So I like this idea of kind of questioning authority, questioning, well, why was that taught in that way, or what was the purpose of creating the protocols for evidence-based medicine or whatever, so that you can be forming opinions for yourself, and that creates autonomy, and that creates the confidence in really being able to step into your truth and your dharma. So how do you recommend people get to that place?
Yeah, I mean, that's a big question, right? I mean, I can only speak to my experience after hitting financial independence. And on some level, you know, when you're working for others, there's a certain amount of compliance, um, right? Like, and it's totally appropriate, right? The organization has certain goals, including revenue
Right.
goals, but a ton of other goals. And they give you money in order for you to do the thing they've asked, right? But you're still submitting yourself to a certain authority outside of yourself. And the whole point of financial independence is that you're reclaiming your own personal authority. And, if you talk about health, how like having a sense of agency, like a sense of personal agency for yourself, there are very few things that are healthier than that.
I love that. This idea of personal agency, I can see how when we embody that as the healthcare professional, and then we also help our patients feel that, like they feel that empowerment, I think. And so one of the biggest struggles that I've had in my career is working with patients who don't feel empowered to take control. They're, well, the doctor told me to take this medicine, and they didn't tell me anything else to do. So, I don't really know what else to do. Or there may be a patient who is not getting the answers that they're looking for. Maybe they're suffering from autoimmune disorders that, now we're seeing more and more. Those can be caused by inflammation at the cellular level, sometimes being caused by chronic stress. And I believe that being out of alignment, that not having the authority over our personal choices in the workplace can kind of erode that sense of empowerment.
Yeah, and I would just point out that, like, the American model is that people should work 40 hours a week. And, in 1933, a very famous economist said that in the future, like in the year 2000, people will be working 15 hours a week and having all their needs met. And we're still working as many hours as we did back then. We just have more things. But this sense of consumerism that we have in America is an illness. Quite frankly, it's an addiction. And, what we've done in the last 100 years is we've traded our ability to have more free time for the opportunity to have more things. And quite frankly, having more and more things is never going to end up making us feel okay. And so, that's the promise of financial independence, that, like, once you have your time, the ability not to work is a very healthy thing. Quite frankly, I hope in like 50, 100 years, people are going to see that working 40 hours a week was sort of a human rights violation.
Yeah. Yeah. I think it's really interesting to hear you say that this ability to achieve FIRE, so financial independence, retiring early, opens up the door to have conversations about what is enough, what is consumerism, what are maybe some unhealthy habits that you have in your life around spending. So I know for me, I was kind of raised in a culture of, like, when we're bored, we go shopping, like retail therapy kind of. When you're sad, you eat, so
Yeah.
I was raised in the South. So there's a lot of stories around food as comfort. And I think that a lot of times working to fill, if we do feel like there's something missing in our lives, trying to fill it with material goods, or fill it with food or alcohol or whatever that looks like, that's a great opportunity to step back and take a look at your life and really say, what are maybe some unconscious habits that I've adopted that are no longer serving me? And what I love about financial independence and the FIRE movement is people are getting very intentional with, you know, how long do I want to work, and what is that concept of enough for me, and do I value the new newly renovated kitchen as much as I value, having that money to be able to take a year-long sabbatical or whatever that looks like for us. So the last question I want to ask kind of pulls all of this discussion together, and your work with people, helping them achieve FIRE and giving them the tools for spiritual direction. Why do you feel that it is important for individuals to be empowered and to really see themselves as healers?
Yeah, I mean, I feel like that anyone listening to your podcast, any healthcare professional, they started in their profession because they had an impulse, and there's impulse towards their dharma. Like fundamentally, anyone who enters the healthcare profession had an impulse to be a healer. And so I think it's like, financial independence is this opportunity to go back to what you originally wanted to do, but in the way that makes you feel in integrity. And one of the first questions I ask, I teach financial freedom. I have a school of financial freedom, and the very first question I ask people is, what is wealth? And you get all these definitions of what wealth is. And it's like spending time with my family, or like being able to exercise or do yoga, or being able to garden, or being able to like pursue the things I most care about. And, the most interesting thing when I ask that question, what is wealth? No one says amount of money, right? Everyone has a sense of, I want time to do the things that I want to do. And that's fundamentally the whole idea behind the FIRE movement, that instead of buying things or even experiences, what you should be doing is buying time. One of the big experiences in my life was my uncle dying. My uncle raised me, and he died of ALS at age 64. And
I'm sorry.
His last pieces of advice for me was, don't wait for anything. He said, I waited my entire life to do things, and I can't do them anymore. He wanted to take my aunt to Europe, never got to go to Europe because he'd been waiting for retirement. He wanted to go back to China, never been back to China. And he couldn't because he was waiting for retirement. And so, the big lesson I learned from that is time is the only non-renewable resource we have. And so your money can either purchase things, a bigger house, the kitchen remodel, or can buy your future time. And prioritizing your future time is the most important thing. And so, at that point, you can see the connection between health and wealth, right? Like if health is an elevated sense of well-being, so is wealth. Wealth is an elevated sense of well-being too. They're functionally the same thing, and they're both really connected to having the freedom of your time.
I love that. Yeah, a lot of times you'll hear people say health is wealth, and that's true. People that have their health have all these wants and needs. People that don't have good health only have one want, and that's to be healthy. And so I think as we're thinking about how to move forward in our own health and well-being practice, that it's really important to get super clear on what is most important to us, what we value. And if we were to seek financial independence, and what would we even do when we get there? So to have that like bigger why kind of pulling us forward, I think, yes, it can be difficult. Change is hard. So it can be difficult to make these shifts outside of kind of the traditional, American diet or approach to exercise and consumerism. But it's making healthy choices, not because from a place of depriving oneself, but really from a place of self-love, that you're doing it in best interest, as well as for your future self, as well as, preserving quality of life, and really, not waiting, like you said, your uncle, biggest regrets that we hear for patients in hospice is not doing the things that they wanted to do, not listening to the call of their heart, and waiting for that. So, Douglas, thank you so much for being here today. For people that want to learn more about how to achieve financial freedom and are interested in working with you, where can they find more information about your work?
Yeah, they can find me in two different places. Schooloffinancialfreedom.com. I teach cohorts of people, adults, who want to take control of their finances to live the life they want. So my next cohort is October, November. It's a 2-month cohort. You can find the listing there. And as a spiritual director, I help people attend to their spiritual lives and pay attention to what's happening inside of them. And you can find me at douglastsoi.com, and I'm sure you'll provide a link on your website.
Absolutely. I will. I'll put links to the comments, and I really appreciate you joining us here for this conversation. Again, this Healing Medicine show, the whole goal of it is to have conversations around health and healing, and what that means for us as health and healing professionals, so that we can have a bigger impact. I really see this as creating a ripple effect when you as a provider are focusing on walking your path for what health and wealth means to you. It's inspiring for others as well, because people look to healthcare professionals as role models. So really being able to embody walking the walk, not just talking the talk, I think is super important. So thank you so much for joining us here for another fantastic conversation. And Douglas, thank you so much for your work in the FIRE movement and for providing spiritual direction for people. So really appreciate your time.
Thanks, Blair.